Hi, everybody. My name is Sarah Meyer, and I'm a board certified behavior analyst that works at Professional Therapy Associates in our Brick and Toms River locations. This is our February portion of our parent training series. And within this parent training series, we are going to be diving into the world of IEPs. So let's take a look at understanding the different components within your child's IEP. Before we dive into IEPs, we're going to take a look at special education, and we're really going to try to figure out what exactly is special education. Special education is an individualized approach through your child's school district to provide support in areas that your child may struggle with academically, functionally, and socially. This may look very different depending on the specific needs of your child and also what is provided through the free and public education within your child's local school district. Special education services may include strategies and supports into your child's day to support growth in targeted areas. Hand in hand with special education comes our IEP. So an IEP, or Individualized Education Program, can be described by the U.S. Department of Education as a written statement for each child with a disability that is developed, reviewed, and revised in a meeting. Within the IEP, there are specific components that must be included. Some of these include the present levels of academic achievement and functional performance, specific goals that are targeted and individualized for your child, progress to how they will meet those goals, and then modifications and accommodations to meet those goals within the least restrictive environment. There's obviously a lot more that goes into our IEPs, but those are really some of the general components that are most important to see in there. The full list can be seen within the link provided within this presentation. So determining eligibility for an IEP. Determining eligibility requires a variety of different components prior to an IEP being put into place. So your child may be eligible for an IEP when the following occur. There needs to be deficits in social, functional, academic, and or behavioral areas that are directly affecting the child's ability to learn within a general education setting. Deficits remain even after documented intervention strategies are put into place. And these may often occur through a response to intervention phase, which is services that are provided to the general education teacher by specialists within the field. Let's take a look as a parent to see what your general roles are during the IEP process. So during the IEP process, parents should expect the following things to occur. Prior to the IEP being given, you will receive a written invitation to the IEP meeting with participants listed within the invitation. Some districts, not all of them, may also send you a copy of the IEP prior to the meeting to review. If you haven't received this is a conversation to have with your specific school district and your case manager. It's also important to let the IEP team know if you're going to be bringing additional supports or services to the meeting. This may include an advocate, a support person, or any outside agencies. It should be noted that if you do decide to bring legal support or an advocate, the school district needs to be notified prior to. In this scenario, the district's legal team will also be present. Let's take a look at the child's roles during the IEP process, because we know the IEP is specifically geared towards the individual child. So during the IEP process, the child may play a role in the meeting. Prior to, speak to your child about how they feel about school and how they feel about their own learning prior to going into the meeting. Starting at the age of 14, the child will be formally invited to the IEP meeting. This starts at the age of 14 because this is when transitional services will first be included within the child's IEP. And those transitional services are going to be looking at our post-secondary education and what the child's plans and goals are going to be once they graduate from high school. If the parents and or the child decide that the child over 14 should not or does not want to attend the meeting, this can be waived. Just let the IEP team know prior to the meeting. Okay, so planning for the meeting. Once you go into this IEP meeting, you're going to see a lot of different people kind of at the table who are all part of your child's educational team. So let's take a look at some of the people that you may see. Within each IEP meeting, there's always going to be a general education teacher and a special education teacher. A general education teacher will be present even if your child receives a majority of their services within a special education environment. Along with those two key players, there's also going to be the school district's case manager. The child's case manager is really the person that is putting together all of the entire IEP. They're the one reaching out to other professionals to make sure all the components are involved, and they're really going to be kind of your main point person within the IEP process. Along with that, we always want the parents or guardians to be included within the meeting. The student may also be involved if over the age of 14 and it's deemed appropriate by the student and the parents. There also may be clinicians included. That could be a physical therapist, an occupational therapist, a board certified behavior analyst, or a speech therapist if it is deemed that your child does need those additional services and if they're already receiving those services. It may also be appropriate that over the age of 14, a transition services agency representative may be included within the meeting to help kind of build that transition from the school environment to the community environment. So once we're planning for the meeting, there's a couple documents that you really want to keep an eye out for. The procedural safeguards. This is a written review of the rights of the parent and child during the IEP process. You are going to receive a copy of this annually or every time that the IEP team meets. This is a really important document, especially when you are unable to come to a collaborative decision with the IEP team about your child's IEP. So this is your document that's going to give you the information on going to mediation or going to due process or any of those additional steps that you may need to make if you do not agree with the school district with your child's programming. And again, the next thing you're going to keep an eye out for is that IEP meeting invitation. It should include all of the participants who will be involved within the meeting. However, you may also receive a request to excuse certain participants from the meeting. This may be, for example, if there's a BCBA and your child is doing really, really amazing with their behaviors, they may excuse the BCBA to move on and discuss more pertinent facts within the IEP. And again, let the IEP team know prior if you're going to be bringing additional individuals so that they can be added to the IEP meeting invitation. And again, it is your right as a parent that you are able to bring whoever you would like to the IEP meeting, even if it's just somebody there to help support you through the process. Okay, so we're going to dive into kind of the main components within the IEP. It is a pretty lengthy document with a variety of different areas. So we're going to kind of take a look at all of those and break them all down. So the first thing you're going to see is the title page, and this is going to list all the general information about your child. I always say, just double check, make sure the contact info, the child's spelling, that all that information is correct. And you're also going to see a list of the IEP participants, and that is going to be kind of just a copy and paste from the IEP invitation that you have previously received. Okay, our next section, and this is really going to be kind of the bulkiest section within the IEP. You're going to see the present levels of academic achievement and functional performance and considerations when developing the IEP. So basically what this goes into is it's going to be kind of a whole list of all the assessments that have been given to your child, any evaluations that have been done. It's going to really be the data that's going to drive a lot of those decisions when making the goals. So you're going to see any evaluation or report results. There also may be information included from the child's last reevaluation. A typical reevaluation occurs every 3 years that your child has an IEP. You may also see information from related services. This is often where they'll put their evaluation results. And you're also going to see a section for any information on statewide assessments. This can be the NJSLAS, the DLM, if it's an alternative assessment, and then any district-wide assessments that the school does give. Okay, so you're going to kind of see that the present levels continues on to the next page, and this is going to be any standardized test results continuation. This may also include any classroom-based assessments. So if your child takes a reading test every Friday or a spelling test, you may see an average or maybe like the last 3 or 5 scores put in there as well. The next areas are the strengths of the student. These can include strengths that are academic, social, and functional. And then the parental concerns area. Make sure that if you do have any concerns related to your child's IEP and the IEP process, that these are documented during the IEP meeting. It's important to know that coming into the IEP meeting, the IEP that's presented is a draft. So it's basically going to be revised and reviewed during that IEP meeting. Okay, the next section, again, you're going to kind of see that continuation of those present levels, but the next area goes into functional performance, which this is going to give information on any social skills, emotional skills, maybe some behavioral skills, but this is going to give kind of the second part of that overall view of your child, where the first section really talks about academics. This is going to talk more about the social and functional components. All right, and then the next area is how the student's disability affects his or her involvement and progress in the general education curriculum. This is typically just a generalized statement that explains why special education services are needed. It'll typically say that because of the areas that are listed within the present levels, that there is a need for special education services because the child is not hitting that criteria on their own. Okay, the next page goes into our special considerations. This page is really just going to be kind of like your chapter list. So it's going to go through a bunch of different components that may be included in your child's IEP or maybe not. It should be noted that if the boxes are checked yes, it will be addressed within the IEP. If it's checked no, it will not be addressed within the IEP. So some areas that may be include if your child is an ESL student or has English as a second language, any communication needs. These are typically if your child receives speech services, you're going to see this box checked yes. Behaviors impeding learning. If your child has a behavior intervention plan or receives any positive behavior support, you're going to see that this box is checked yes. Needs for assistive technology. So that's if your child requires any sort of specialized technology or equipment to assist in their learning. A transition plan. So if your child's over the age of 14, it'll be checked. If they're not, it'll be checked no. Any information on visual impairments and hearing impairments. So those will all be checked if those specific areas need to be addressed within the IEP. Okay, the next component begins with the needs that are addressed within the child. So the needs, if something is listed in here, it is going to be directly pulled from the present level, and it also is going to be addressed within the IEP directly. So that's a really important area to look at because those are typically going to be the main focus areas within the IEP that the child has. And then the next area jumps into transition planning. So again, this begins at age 14 for children and adolescents. So the next couple pages we're going to see here also revolve around transition planning. The first area goes into consultation and interagency participation. So that is if there's any agencies that are involved with your child's learning, perhaps it's something in the community, the school's responsibilities, and then the student and parent responsibilities with that agency. Your child will also receive a separate set of goals, and those are going to be our post-secondary goals. And those are going to be goals related to what your child is going to plan on doing after they graduate from high school. So this could be information on education, if they want to go to college, if they want to do something different. what kind of careers they're interested in, and then also kind of what their independent living skills are at this point. All right, so again, we're going to continue on with the transition planning section and continue on with those post-secondary goals. So with those goals, there's going to be activities and strategies that are going to explain how we're going to meet those goals. These can be focused on daily living schools, community experience, etc. So for example, in a lot of our special education programs in the high school setting, your child may go out to a working location. They may do some work-based learning within the community. So all of that is going to be included within this section. Okay, the next area are behavioral interventions. It should be noted that this may or may not be included for your child, depending on the severity of the behaviors that they're exhibiting within the school district. So some strategies may be included for for behaviors with mild to moderate severity. In this situation, your child may not have a full behavioral intervention plan, but they may just have some behavioral supports and strategies that are going to be addressed later within the IEP. A behavior intervention plan, or a BIP, may be applicable for behaviors with a moderate to severe severity. So in these situations, if the behaviors are really impeding the child's ability to learn within their least restrictive environment. Okay, so in the next area, again, you're going to see a little bit more from that behavioral intervention piece. And then we go into the progress reporting and goal areas. So this is where you're going to see your child's annual measurable academic and or functional goals. The progress reporting section is going to let you know how often you're going to be made aware of the child's progress within these specific goals. Within the annual measurable goal areas, these are going to be areas that are listed specifically. So maybe it's an ELA or reading goal, maybe it's a math goal, maybe it's a social goal. But you're going to see that in the first section where it says area. The next part is you're going to see the long-term goal. This is going to be the goal that we want the child to be able to accomplish by the end of the IEP. In order to make sure that we're reaching that long-term goal, your child may have some additional short-term goals that are going to be the building blocks and the building steps to hit that long-term goal. When we're looking at IEP goals, we really want to make sure they hit 5 different criteria. And we like to call these that IEP goals should be SMART. SMART, so the S is specific. We want the goal to be specific to a subject or skill. We want it to be measurable. We're going to see exactly how we're going to be collecting data on that goal. We want it to be attainable. This is really important. We really want to make sure that the goals we lay out for our kids are realistic and know that, we only have a certain amount of time to hit this goal. So we might have to dial back our expectations sometimes and really make sure that we're hitting all of those precursor skills before our main goal is addressed. We want to make sure that they're result oriented. So again, we're going to start with a small goal and we're going to build it up as we're successful. And then we want to make sure that they're time bound. We want to know approximately how long it's going to take for the child to reach this goal. All of these goals will be updated as the year progresses, depending on the progress. So let's take a look at some examples of what you might see in an IEP goal. So an example of a long-term goal. When presented with flashcards of the uppercase letters A through Z, Johnny will expressively identify the letter by saying what letter it is and will expressively identify the sound, including long and short vowel sounds. When asked by saying the sound with 80% accuracy per weekly trial for 3 out of 4 weekly trials by the end of this annual IEP. Now that's a pretty lengthy goal and there's a lot of skills to be addressed there. So that's when we really take a look at those short-term goals. An example of a short-term goal that would go with the long-term goal we just read is when presented with flashcards of the uppercase letters A through J, Johnny will expressively identify the letter by saying what letter it is with 80% accuracy per weekly trial for 3 out of 4 weekly trials within 3 months. So you can see with that, we are decreasing the amount that's being asked of the child, and we're really targeting specific areas so that we can continue to grow in that goal. Okay, the next area is our modifications and supplementary aids and services in the general education classroom and or special education classroom. So this is going to give you a lot of information on the modifications and accommodations that will be put in place for your child. The best way to identify it is a modification is the physical changing of something, when accommodating is adding something into the environment. You may also see information on supplementary aids and services, and then information if your child utilizes any assistive technology to assist in their learning. All right, so the next area goes into our supports for school personnel, and then the statement of special education programs and related services. Your supports for school personnel are going to give you information on how other people are going to support the teachers and staff that are working with your child. So for example, if your child receives speech services, you may see a consultation time in there for the special education teacher and for the speech therapist. And this is saying that there is going to be time allotted for both of those professionals to be able to collaborate and work together on ensuring that strategies are being utilized for your child in a variety of environments. The statement of special education programs. This is basically going to give you a list of the special education program and general education placement. Okay, so our next area goes into related services. If your child receives speech, OT, PT, any of those, you're going to see it within this section. Along with that, also special transportation and related services. So when your child has an IEP, they may be eligible for specific transportation to and from school, whether it be a bus, whether it be a smaller bus with a seatbelt. You're going to see that information within this section. And then at the very bottom of this, you're going to see the beginning of extended school year. Okay, so we're going to continue on with the extended school year programs and goals. This is going to identify the placement decision as well moving forward. So for the extended school year, it's important to note that just because your child has an IEP, it doesn't necessarily mean that they're going to qualify for extended school year services. How this typically works is the school district will often review data from before and after long breaks that are built into the child's schedule. So for example, winter break. They may take a look and see if there was any regression or if there was really a big need to reteach those skills. And that often plays a big part in determining eligibility for extended school year. The placement decision, that's going to give you information on where your child is going to be placed. That might be that maybe they are in a special education setting for 60% of the day, in a general education setting for 40% of the day. Maybe they're in a classroom specifically for students with autism, or a classroom for children with multiple disabilities, or that they're going to be in the general education placement. So that's an important area to take a look at as you're moving through the IEP. And then the rationale for removal from general education. Again, it's going to be a pretty typically generalized statement. That's basically just going to say, because of the learning issues that are addressed within this IEP, this is why we are determining the change of educational placement. Okay, so again, it gives you a little bit more on transition planning activities for the students, modifications in extracurricular and non-academic activities, the length of the school day, and information on transitioning from elementary to secondary. Again, these are going to be kind of a lot of just those, like, we need to have it in the IEP, but nothing that's going to be super, super really particular. Again, most of those generalized statements for you. And then it's going to begin to talk about how your child is going to participate in assessments. So the next area talks about your child's participation in district-wide and statewide assessments within their district. So this is going to begin by talking about what type of assessment the child is going to take. This could be whether they're taking just the regular statewide assessment that all students are taking, or if they're going to be taking a modified statewide assessment due to the severity of their disability. You're also going to see any modifications and accommodations that are utilized during testing. So if your child receives maybe a small group setting, if they receive extended time, this is where you're going to see that information. And this kind of continues on to the next page as well. Okay, so the next area just goes into graduation requirements. It's just going to say, is this going to be the same as their typically developing peers, or is it going to look a little bit different? And then the final couple pages are going to be, again, your notice of requirements for the IEP and placement. It's just going to say, you know, this is why we've made this decision to change the placement. And then this is kind of the supporting factors behind it. And then the next area goes to transfer of rights. So just saying these are going to be the rights of your child with their IEP once they surpass the age of 18. And then finally, it is ending with that procedural safeguards notice. So it's just saying, again, that you're going to receive a copy of this. And if you need any additional support, this is the information at where you can reach out to find it. Okay, so I know the IEP itself is a very lengthy document, and typically during the IEP meeting, you're going to be discussing a lot of information in a pretty short period of time. So after the IEP meeting, it's important to do a couple things. So it's really important to remember that as a parent, you have 15 days after the meeting to review the IEP draft. You do not have to sign and agree to the IEP within that meeting. However, maybe you've done this a couple of times, you have a really great relationship with the district, you love where your child is at. You do have the right as a parent to waive that 15-day period and just be able to sign that IEP at the meeting and continue on and continue forward. And it's really important, take some time to reflect on what you've talked about. A lot of the times during the IEP meeting, it's a lot of talking about things that your child needs and areas that are deficits for your child. So it's really important just to take that time to really review on the strengths that your child does have, and that you do have a collaborative team that you can reach out to and work through everything with. And that is the conclusion of our parent training series. I know, just like an IEP meeting, this is a lot of information to take in all at once, but I hope by utilizing the virtual format, you guys are able to kind of backtrack this, review some of the information, and also go back to the components that you think are most important. If you do have any additional questions or would like to do a quick Q&A, please feel free to reach out to professional therapy associates within the Brick and Toms River location and ask for myself, Sarah Meyer, and I'll be happy to work you through any of these areas a little bit more in depth. Thank you very much and have a wonderful day.